Deep within the human body, a silent enemy often lurks undetected. It grows insidiously, often without announcing its presence until it's significantly advanced. This enemy is hepatocellular carcinoma, the most common type of liver cancer. HCC is a formidable foe, claiming the lives of hundreds of thousands each year worldwide. It often remains asymptomatic in its early stages, making early detection a significant challenge. The insidious nature of HCC makes it crucial to understand its potential threat. Early diagnosis is paramount when battling this disease. When detected early, HCC can often be treated effectively, offering patients a better chance at survival. This essay delves into the intricacies of HCC, shedding light on its symptoms, the challenges in early detection, and the importance of awareness. The liver, the largest internal organ in the human body, is a biological workhorse, performing over 500 vital functions. It filters toxins from the blood, produces bile essential for digestion, and plays a crucial role in metabolism. Given its multifaceted role, any compromise in liver function can have cascading effects on overall health. HCC disrupts the liver's intricate workings, impairing its ability to perform these vital tasks. As the cancerous cells proliferate, they damage healthy liver tissue, leading to a decline in liver function. This decline manifests as a range of symptoms, providing crucial clues about the underlying condition. Recognizing these symptoms is often the first step towards diagnosis and treatment. Hepatocellular carcinoma, as the name suggests, originates in the main cells of the liver known as hepatocytes. It's characterized by the uncontrolled growth of these cells, forming a malignant tumor. HCC is primarily linked to chronic liver diseases, with cirrhosis, a condition characterized by scarring of the liver, being a major risk factor. Other risk factors include hepatitis B and C infections, excessive alcohol consumption, and non-alcoholic fatty liver disease. Understanding these risk factors is crucial for prevention, as mitigating them can significantly reduce the likelihood of developing HCC. Hepatocellular carcinoma in its initial stages rarely announces itself. It grows silently, often without causing noticeable symptoms. This asymptomatic nature is a double-edged sword. While it may provide a false sense of security, it also poses a significant challenge in early detection. During these early stages, the tumor is typically small, and the liver, being a highly resilient organ, can often compensate for the minimal damage caused. This compensation allows the body to function seemingly normally, masking the underlying threat. However, as the tumor grows and the disease progresses, the liver's ability to compensate diminishes, leading to the manifestation of noticeable symptoms. Early detection is paramount in the fight against hepatocellular carcinoma. When diagnosed in its early stages, HCC is often curable. Treatment options are more likely to be successful, offering patients a better chance at long-term survival. Early detection allows for timely intervention, preventing the cancer from spreading to other parts of the body. This localization of the tumor makes treatment more effective and less invasive. Conversely, late-stage diagnosis often limits treatment options, with palliative care becoming the primary focus. While HCC is often silent in its early stages, certain subtle signs can serve as early warning signals. These signs, though seemingly insignificant, can provide crucial clues about the underlying condition. One such sign is a persistent, dull pain or discomfort in the upper right abdomen, where the liver is located. Another early sign is unexplained weight loss, often accompanied by a loss of appetite. Fatigue, weakness, and a general feeling of malaise can also be indicative of early-stage HCC. While these symptoms can be attributed to various other conditions, their persistence, especially in individuals with risk factors for HCC, warrants immediate medical attention. Given the often subtle nature of early HCC symptoms, vigilance is key. Individuals at risk, particularly those with chronic liver disease or a family history of HCC, should be particularly vigilant about their health. Regular medical checkups, including liver function tests and imaging studies, are crucial for early detection. Being aware of potential symptoms and reporting any unusual changes to a healthcare professional can be life-saving. Early detection is the cornerstone of effective HCC management, offering the best chance at successful treatment and long-term survival. Unmasking the enemy, recognizing the symptoms. As hepatocellular carcinoma progresses, it begins to exert a more noticeable impact on the body. The liver, once able to compensate for the tumor's presence, struggles to function optimally. This struggle manifests as a range of symptoms, providing crucial clues about the underlying condition. Recognizing these symptoms is often the first step towards diagnosis and treatment. Early detection, as we've established, is paramount in the fight against HCC. It's important to remember that these symptoms can also be indicative of other medical conditions. However, experiencing any of these symptoms, especially if you're at risk for HCC, warrants immediate medical attention. Abdominal pain, a telltale sign. One of the most common symptoms of HCC is abdominal pain. This pain typically occurs in the upper right quadrant of the abdomen, where the liver is located. It can range from a dull, persistent ache to a sharp, stabbing sensation. The pain may worsen after meals or when lying down. The pain associated with HCC is often caused by the tumor's growth, which stretches the liver's capsule, a sensitive layer of tissue surrounding the organ. As the tumor grows, it can also press on nearby nerves and organs, contributing to the pain. In some cases, the pain may radiate to the back or shoulder. Jaundice, yellowing skin and eyes. Jaundice, a condition characterized by yellowing of the skin and whites of the eyes, is another telltale sign of HCC. This yellow discoloration is caused by a buildup of bilirubin in the blood. Bilirubin is a yellow pigment produced during the breakdown of red blood cells. Normally, the liver processes bilirubin and excretes it in bile. However, in HCC, the tumor can block bile ducts or impair the liver's ability to process bilirubin. This blockage or impairment leads to a buildup of bilirubin in the bloodstream, resulting in jaundice. Section 4. Loss of appetite and weight loss. Red flags to heed. Unexplained weight loss and a persistent loss of appetite are common symptoms of HCC, often occurring in the later stages of the disease. As the tumor grows, it can compress the stomach or intestines, leading to a feeling of fullness and a decreased desire to eat. Furthermore, HCC can disrupt the liver's metabolic functions, affecting the body's ability to process nutrients and produce energy. This disruption can lead to muscle wasting and overall weakness, contributing to weight loss. Section 5. Other manifestations, swelling, fatigue, and more. In addition to the primary symptoms, HCC can manifest as a constellation of other health issues. Ascites, a condition characterized by fluid buildup in the abdomen, is a common complication of HCC. This fluid accumulation can cause abdominal swelling and discomfort. Fatigue, a persistent feeling of tiredness and lack of energy, is another frequent complaint among HCC patients. This fatigue can be attributed to the liver's compromised ability to perform its metabolic functions, leading to a decrease in energy production. Other possible manifestations of HCC include fever, nausea, vomiting, and easy bruising or bleeding.
Dr. Valentino to the OR, please. Dr. Valentino to the OR, please.
Section 1. The Challenge of Silence. Early HCC often whispers, it doesn't shout. The insidious nature of hepatocellular carcinoma lies in its silent progression during the initial stages. Unlike many cancers that announce their presence with noticeable symptoms, early HCC often remains hidden, growing stealthily within the liver's depths. This silent growth poses a significant challenge to early diagnosis, as individuals often remain unaware of the developing threat until the disease has advanced. This lack of early warning signs can create a false sense of security, delaying crucial medical intervention. The liver, being a highly resilient organ, can often compensate for the minimal damage inflicted by the small tumor in the early stages. This compensation allows the body to maintain its normal functions, masking the underlying threat and making early detection a race against time. Adding to the complexity of early HCC detection is the nonspecific nature of its symptoms, especially in the initial stages. The symptoms that do arise, such as abdominal discomfort, fatigue, or loss of appetite, can easily be mistaken for more common and less serious conditions. This overlap with other ailments often leads to misdiagnosis or delayed diagnosis, allowing the cancer precious time to progress. For instance, the vague abdominal pain sometimes experienced in early HCC can be attributed to indigestion, gas, or even muscular strain. Similarly, fatigue, a common symptom across a spectrum of illnesses, may be disregarded as a sign of stress or overwork. This masking effect underscores the importance of a thorough medical evaluation, especially for individuals with risk factors for HCC. The liver, while susceptible to HCC, is a remarkably resilient organ. It possesses a remarkable capacity for regeneration, able to withstand a significant degree of damage before its function is noticeably affected. While this resilience is crucial for maintaining overall health, it can also work against us in the context of HCC. The liver's ability to compensate for the early stages of tumor growth allows HCC to progress undetected as the body continues to function seemingly normally. This silent progression delays the onset of noticeable symptoms, making early detection reliant on proactive screening rather than a response to overt signs of illness. Given the challenges inherent in detecting early HCC based on symptoms alone, understanding its risk factors becomes paramount. Certain populations are at a significantly higher risk of developing this type of liver cancer, and recognizing these risk factors can guide targeted screening efforts. Chronic infection with hepatitis B or C virus is a major risk factor for HCC. These viruses cause long-term inflammation of the liver, increasing the likelihood of developing the disease. Similarly, cirrhosis, a condition characterized by scarring of the liver often caused by excessive alcohol consumption or fatty liver disease, significantly elevates the risk of HCC. Identifying individuals with these risk factors allows for proactive monitoring and early intervention strategies. Section 5. Bridging the Gap: Early Detection Strategies for At-Risk Individuals. Early detection of HCC relies heavily on proactive screening, especially for those with identified risk factors. Regular medical checkups, including liver function tests and imaging studies, are crucial for identifying early signs of the disease. Ultrasound and magnetic resonance imaging, or MRI, are particularly useful in detecting liver tumors, even in their early stages. These imaging techniques allow doctors to visualize the liver structure and identify any abnormalities. Blood tests for specific tumor markers, such as alpha-fetoprotein, also known as AFP, can also aid in early detection. By bridging the gap with proactive screening and heightened awareness, we can combat the silent progression of HCC and improve patient outcomes. Section 1. Unmasking the Hidden Enemy. Diagnostic Tools for HCC. Diagnosing hepatocellular carcinoma, especially in its early stages, is like solving a complex puzzle. It requires a combination of clinical acumen, a thorough understanding of risk factors, and a range of diagnostic tools. These tools act as our eyes and ears, allowing us to peer inside the body and detect the subtle signs of this elusive disease. The journey often begins with a detailed medical history and physical examination, where doctors assess the patient's symptoms, risk factors, and overall health. This initial assessment guides the selection of appropriate diagnostic tests, each providing a piece of the puzzle that contributes to an accurate diagnosis. Section 2. Imaging the battlefield ultrasound and MRI in HCC detection. Imaging techniques play a pivotal role in visualizing the liver and identifying any suspicious growths. Ultrasound, a non-invasive and widely available imaging modality, uses sound waves to create images of the liver. It can detect tumors as small as 1 to 2 centimeters, making it a valuable tool for early HCC detection. Magnetic resonance imaging, or MRI, a more sophisticated imaging technique, provides highly detailed images of the liver and surrounding tissues. MRI uses a strong magnetic field and radio waves to create these images, offering a clearer view of the tumor's size, location, and blood supply. This detailed information is crucial for determining the stage of the cancer and planning the most effective treatment strategy. While imaging techniques provide a visual map, biomarkers offer molecular clues about the presence of HCC. These biomarkers are substances found in the blood that can indicate the presence of cancer. Alpha-fetoprotein, or AFP, a protein produced by the liver, is a commonly used biomarker for HCC. Elevated levels of AFP in the blood can be an early indicator of HCC, although it's important to note that AFP levels can also be elevated in other liver conditions. Therefore, AFP testing is often used in conjunction with imaging studies to improve diagnostic accuracy. Section 4. Charting the course biopsy for confirmation and staging. While imaging and biomarker tests provide valuable information, a biopsy remains the gold standard for confirming the diagnosis of HCC and determining its stage. A biopsy involves obtaining a small sample of the tumor tissue, usually through a needle inserted through the skin and into the liver. This tissue sample is then examined under a microscope by a pathologist to confirm the presence of cancer cells. The biopsy also helps determine the grade of the tumor, which reflects how aggressive the cancer cells appear and how quickly they are likely to grow and spread. This information is vital for guiding treatment decisions and predicting prognosis. Section 1. HCC, a call to action. Hepatocellular carcinoma stands as a stark reminder of the complexities and vulnerabilities of the human body. It's a disease that often operates in the shadows, silently gaining ground before revealing its presence. This silent progression underscores the urgency of raising awareness about HCC, particularly among those most vulnerable. We must break the silence surrounding liver cancer, fostering open conversations about its risk factors, symptoms, and the importance of early detection. This knowledge is our most potent weapon, empowering individuals to take charge of their liver health and seek timely medical attention. Early diagnosis is our greatest ally in the fight against HCC, offering the best chance for effective treatment and long-term survival. Section 2. Empowering ourselves, knowledge, vigilance, and hope. While the statistics surrounding HCC can seem daunting, It's crucial to remember that knowledge is power, and early detection saves lives. By understanding the risk factors, recognizing the subtle early warning signs, and seeking prompt medical attention, we can dramatically improve outcomes for those affected by this disease. Vigilance is key, particularly for those at increased risk due to chronic liver disease, hepatitis B or C infection, or a family history of HCC. Regular medical checkups, including liver function tests and imaging studies, are essential for early detection and timely intervention. Let's empower ourselves with knowledge, remain vigilant about our health, and approach this challenging disease with a sense of hope and determination.